Hi, my name is Donna Steele, and I'm a nurse in the operating room. Today I'm going to teach you how to perform a surgical scrub. Before we scrub in for surgery, it's important to think about our surgical attire. So starting from head to toe, we need to ensure that our hair is completely covered by some sort of head covering. Because I have a lot of hair, I use what's called a bouffant to make sure that no hair is sticking out around my head, my ears, or the back of my neck. Also, if you have any earrings, they need to be secured within the scrub cap as well. We need a surgical mask for surgery. Mine has an attached visor. Despite the fact that I do have rather big glasses, they don't cover the sides of my face. So to make sure I don't get any sort of splashing, I wear an extra mask that covers the side of my face. We want to make sure the mask is pinched against your nose. That helps with people who wear glasses to prevent fogging. And also tied at two different spots on your head to keep it fitting securely around your face and around the bottom of your chin. We should wear hospital laundered scrubs. Our hospital provides them. The top needs to either be tucked into your pants or fit snugly at the side. The tie to your pants should also be tucked in so that it doesn't go touching any part of the surgical field if you're not scrubbed in. If you're performing a surgical scrub, we have to scrub above 2 inches above the elbow. So if your sleeves are a little bit longer, you'll need to roll them up. Fingernails should be free of any nail polish. If you do have regular nail polish on, it cannot have any chips. We do not permit acrylic nails or gel nails at this institution. And your fingernails should also not be any longer than 1/4 of an inch. That way we don't go tearing through any of our gloves. And we also want to make sure that our shoes, if they're not hospital worn only shoes, that they have shoe coverings on them and they have a closed toe so that you don't get any injury or splashing. After you have your surgical attire on, we want to pick our surgical scrub. We provide 3 different types of surgical scrubs for our first scrub of the day: chlorhexidine, PCMX, or povidone iodine. They're all approved by the hospital, so you can choose whichever you like. I choose the PCMX purely because it has the softest sponge. Before we get to this, we need to do a chlorhexidine scrub for our first washing of the day, just to get any gross debris off of our hands. Before we do that, I'm going to go ahead and open my scrub brush because it's a lot easier to do when your hands are dry. This sink is foot pedal operated. Some of them have a little kick-on switch. That allows you to not use your hands once you're scrubbed in for surgery. And again, this is just a quick wash to get any gross debris that you might have brought in from the outside. Now we're ready to start. In your scrub package, you have a nail cleaner, your sponge, and then a little scrubby side to your brush. You start by cleaning under your nails with the scrub cleaner under running water. Doing it under running water allows anything under your nails to just get washed down the sink and not end up in your scrub brush. Once you're done with that, you can throw your pick away. And then we're just going to clean our nails with the little scrapey cleaner, getting underneath each fingernail and then doing the tops of each fingernail, especially where your fingernail meets your skin. A lot of stuff can hide in there. Now, something that I like to do after my nails are clean is just rip the little scrubby part away from the brush, just so I don't scratch any part of my skin. My hands are wet, my brush is wet, now we're ready to go. We need to pretend that each part of our hands and arms that we're scrubbing has 4 distinct sides, so I like to pretend that my fingers are rectangular prisms. Each side gets 10 strokes, and a stroke is an up and down motion. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now the speed at which you do this doesn't matter. So when we've been here for a little while, we can do this a lot faster. The number of strokes does. A surgical scrub should take about 3 to 5 minutes. We always start from our fingers and work our way down to our elbows, doing one hand at a time. We split our forearm up into 2 parts. The first part goes from about our wrist to about halfway up our forearm, and then the second part is our anticube and about 2 inches above our elbow. Again, 10 strokes on each side, imagining that there's 4 distinct sides. While we're scrubbing, we want to try to keep our arms over the sink so that we don't get any water or scrub solution on the floor and then slip later. We're here for patients. We don't want to become the patients. Again, always being mindful of 2 really important things, that the front of our scrubs aren't touching the sink, and that, which I didn't really just do, and that we're keeping our hands above our elbows so that if there is any dripping, it drips down to the non-scrubbed side. Once we've done our one arm, we can switch on over to the other. Everyone that's scrubbing in for surgery does have to do a surgical scrub. There are no exceptions. Scrub technologists and nurses, residents, medical students, surgeons, we all have to scrub in. The purpose of performing a surgical scrub is to perform chemical antisepsis and mechanical washing to limit the number of microorganisms on our hands. This scrub that you're watching me do needs to be done for the first scrub of your day. Once you've done this scrub, we can use the sterilium rub, which is another type of surgical hand antiseptic. It's waterless. It should still take about the same amount of time. But the good thing is that you don't get wet, so you're not going to drip anywhere, and you don't have to worry about it drying off. You can just go right into putting on your gown and glove. When you're done with your scrub, take your brush, throw it into a garbage, and then we're going to rinse again, keeping our scrubs away from the front of the sink, keeping our hands up and going from fingertips to elbow. When you're done, just give a little shake, and you're ready to go into the operating room.